Good afternoon and welcome to United TV. It's our Bariatric Friday. Today is June 27th, Friday, and 1 week to 4th of July. So today we are going to bring another essential insight into the world, bariatric surgery and long-term health. And I am your host, and I have Dr. Irgau joining me. And one important topic that we are going to cover today is what's expected after the bariatric surgery from the patient standpoint and the family. And we need to better understand the recovery and emotional challenges, diet stages, and long-term success strategies. So that's what we are going to discuss today. And Dr. Irgau, as usual, he's with me. And Dr. Irgau, we are going to go back and forth with some of the background information on bariatric, but I want to kind of stay with some of our questions in the beginning so that for those who already watch our playlist, and we have covered this so many times, so they can actually have like one kind of like a question answer video, because there's so many videos now. So now the first thing that we have is what's the typical recovery timeline after bariatric surgery, and what should the patient expect within the 72 hours of the surgery? That's where we are going to start with.
Absolutely. So generally, if the procedure is done in a place like our bariatric center, the American Surgery Center, the stay in the center is actually the same day. So patients will be coming in the morning to have their surgery, and they will be going home the same day. In hospital procedures, very often patients stay overnight. It's very rare for patients to have to stay more than one night, essentially. So, as I said, the vast majority of patients will be going home the same day. And this is something that we are able to do because we have excellent ways for controlling some of the problems we used to see after surgery, like pain or nausea. Our patients have very mild pain medications, and they do very well with that. In fact, we've gone away completely from narcotic pain medication nowadays. So the patients will have good pain control, but at the same time, their mind will be clear, and they will not have problems in the digestive system that very often are related to narcotic medications.
So because the 72 hours is overall, it's important on the recovery, but the first 2 hours is even more important, but then maybe even more important is the first hour. And the changes that we have made in our surgery center, I say, like when I say patient-oriented, people say that the hospitals are not patient-oriented. Well, patient-oriented in a way that we're not shying away from spending a little bit more on medication, to make sure that there are some proactive medications in place that can make the recovery a lot pleasant.
Absolutely, absolutely. So, for instance, pain medications are not started when the patient complains of pain. They're started well before that. In fact, before the surgery, patients are administered medications that will actually modify how their body will perceive pain. Same with nausea, for instance. We administer very powerful anti-nausea medication before the surgery so that patients wake up from very complex bariatric procedures without any nausea, very often very, very comfortable. So, as I said, they go home the same day, but obviously there are very important things that they need to focus. One of them is hydration. It's very important that they stay well hydrated. After the surgery, their stomach is very small, and they're not going to be capable of drinking a big amount of water. So we want to make sure they don't stay behind with their water intake. They cannot afford to find themselves very thirsty, because then keeping with that up with that will be very difficult. So we teach them on strategies to keep hydrated by taking small sips continuously. We want them to be up and about frequently. We want them to walk very early, starting very early after surgery, and then very frequently after that, because that's the way to enhance recovery, but also to minimize complications like blood clot or pneumonia. So in the first 72 hours, staying focused on hydration, walking frequently are very, very important things. And obviously the way we plan and administer medications help the patient greatly, because discomfort is not going to be in their way, nausea is not going to be in their way to do these important things.
So the post-surgery diets are introduced in stages: liquids and pure, and soft food and solid food. Each stage helps the stomach heal and adjust to its new size and function. How is the post-op diet structured, and why is it critical to follow each phase carefully?
So the diet phases that we have are crucial to safe recovery after bariatric surgery. As you mentioned, after bariatric surgery, the stomach is very small. It has been operated on and it's extremely sensitive. So patients have to really follow this schedule that we ask them for them to stay safe. And also, if they don't follow this, the likelihood of them becoming sick with nausea, maybe vomiting, or even more serious complications are obviously high. In the first 2 weeks after surgery, patients will be on what we call a liquid diet. So anything that they will intake will be just in a liquid form. In fact, the first 2 days, it's going to be clear liquids. And then after the first 2 days, for the following 2 weeks, they will be in what we call full liquids. The difference between clear liquid and full liquid is simply a clear liquid will be something that they can see through, right, on a glass, whereas a full liquid could be a thickened liquid, soup or protein shake, and so forth. But it's important that anything that they have is in a liquid form. That's for the first 2 weeks. After the first 2 weeks, they will progress to what we call a puree diet. A puree diet will give them more options, obviously. The intake will be much more substantive, but they cannot still take anything that requires chewing, right? So what is the definition of a puree diet? A puree diet is any type of food that doesn't require chewing. So when I teach patients about this, I tell them you have to pretend to be an infant without any teeth, right? You wouldn't give a raw carrot to an infant that doesn't have teeth yet, right? They cannot chew it. It is the same in the 2 weeks of puree diet. Anything that they want to eat, they will either have to mash it with a fork, put it in a blender, puree it, right? So if they look at the food and say, oh, can I eat this without chewing it? And if the answer is yes, then they can have it. If it requires chewing, then they cannot have it. That's a fairly simple way to really understand this. And what's the reason why this is important? As I said, the stomach is very sensitive. But more importantly, for instance, if patients were to go in and start eating something that is much more substantive, that is eaten by chewing it, and then perhaps something goes in that hasn't been really chewed well, then the stomach can be damaged. It's in its early healing stage. And if the stomach is damaged, leakage can occur from the stomach to the inside of the abdomen, which can cause a very serious and potentially life-threatening infection. So when we ask patients to stick to these steps, to this schedule of diet progression, there are very important reasons behind it, and patients should follow them.
Mm-hmm. So patients may have very often unrealistic expectations from the surgery, either overestimating rapid weight loss or fearing it won't work for them. Education helps them to stay engaged and motivated. But from the weight loss and expectation standpoint, what kind of a weight loss patients expect in first year, and how can they maintain that in the long term?
Sure, absolutely. So most of the weight loss occurs in the first 6 months after the surgery. Mm-hmm. It is safe to say that in the first year after surgery, most patients will lose anywhere between 60 to 70% of their excess weight. So, for instance, if a patient's ideal weight is 150 pounds, but they have 250 pounds, and they need to lose 100 pounds to get to their goal, it means that within the first year, they will be losing anywhere between 60 to 70 pounds. That's a good way to look at it. But as you correctly said, it's important to set expectations right, okay? First of all, people are individuals, and individuals vary in terms of how fast or how slowly they lose weight. But also, it's important to consider their starting point. Somebody who is 400 pounds and you compare that person with somebody who's 230 pounds, both of them could have the sleeve gastrectomy, but the person who is 400 pounds will be losing weight much more quickly than the person who is 230 pounds. And this realization is important because patients very often will compare themselves to others who have had surgery, either because of they know someone or because they may go online and see that this person has lost this much or that person has lost this much, and then they invariably will be mirroring that to themselves and see whether there is something wrong with their process. It is important to understand everybody is different. The other thing that patients need to understand is that weight loss is so different that there are many people who've had the same lifestyle as they have, but never had any weight problem, right? So not everybody is the same. Everybody should look at their own journey as their own and just focus on important things in terms of staying in shape, staying well hydrated, make sure that what they're eating is very healthy, make sure they go to support groups. So to really summarize, to an answer to your question, what is the weight loss like? Well, in the first 3 to 6 months, there will be rapid weight loss. After that, it does slow down, but the vast majority of the weight loss will occur in the first year after surgery.
So that's rapid weight loss sometimes gets them in trouble because they see results very quickly and they don't want to see us again because now they lost 150, 160 pounds. And I mentioned last week we have this new project that I'm actually training someone, and it's incredible, and it's extremely rewarding for us to be. For me, I'm not a clinician, so for me to be part of that outcome is extremely rewarding. So I know that because of our drop rate being extremely low and keeping those patients in the program, that requires our structure. And I know I have some responsibilities in that. So I take a great honor of that to see how can someone lose 160 pounds in 6 months. And this is what they go through. So, of course, with the weight loss, impacts self-image, relationships, and mental health. And the patients usually have some, very often they're surprised by the emotional shifts they may have after the physical transformation. So what are the most common challenges patients face emotionally after surgery?
There will be challenges. There is no question about that because the transformation is so major, right? And because weight has been such a critical problem for most of their life, and they feel totally liberated as the weight is coming off now without any problems. For some, it's really a boost in confidence. It's wonderful. For others, they feel anxious about it. They feel anxious about, their relationship with food. Particularly if food was a way for them to deal with stress in the past. But also, just as importantly, self-image and relationships can be affected by the weight loss because critically, when the weight loss occurs, you see it. You see the transformation. Patients will be able to see their picture a year before and now. They will be able to see that the clothes that they used to wear are way too big now compared to what they need now. And also their loved ones, their friends, and others that have a relationship with them will see that as well. Now, some of the people who are their friends or family may be supporting them. For others, this may be a threat, really, because now the patients may have more confidence. All that will create a number of potential emotional challenges. That's why it is very important for patients to always follow up so that they can talk about these challenges because we do see this very often and we can provide solutions and answers to many of the questions patients have in this setting. Another important platform for patients to be able to utilize to overcome these problems is support groups, and we do talk about the importance of support group in our Bariatric Friday sessions. And these are very, very relevant because patients will be able to share stories of problems they've had, but also of solutions that they've been able to implement to overcome this.
And the support group, speaking of support group, there are two different ways that patients can actually benefit from them, two different places that they can go through. One is on our Facebook. There's a private group. We verify those patients one by one before they're admitted. So then, and we also monitor what's happening, what discussions is happening. Are they promoting anything, or are they really just sincerely sharing what they are going through? And the other one is every first Tuesday of every month at 5 p.m.
Yep.
led by Dr. Galvin, and we do have different specialties joining based on the topic that time. That's through Zoom, and our patients can register for the program directly from our website. So, well, because part of the stomach and small intestine are bypassed or restricted, the nutrition absorption is reduced, and without supplements, this can be harmful for the patient and may have serious deficiencies in the future. So, what supplements are needed after bariatric surgery, and why are they lifelong?
So vitamins are very critical after bariatric surgery. And as you correctly said, because of the changes we make in the digestive system, either with the sleeve gastrectomy or gastric bypass or the duodenal switch, the body's ability to process these vitamins and absorb them is going to be different. It's going to be diminished. So in order for patients to be able to intake the necessary amount of vitamins that they need on a daily basis, they will have to supplement their nutrition with vitamins. So patients will be typically on a multivitamin regimen. They will be taking calcium, they will be taking vitamin D, and very often they may need additional vitamins like B12 as well. Particularly patients who had gastric bypass will need that. And this is really something that happens because of the changes of the surgery. So it makes no sense at all to have the surgery done to improve one's health, but then to not to be compliant with vitamin intake and then put their health in jeopardy, right? We're not doing bariatric surgery to exchange one illness for another. We want to make sure all these illnesses are gone. And if patients don't take vitamins adequately, they could have potentially serious problems, whether it's hair loss, whether it's bone weakening, whether it is poor healing of a wound, or even nerve damage can occur if these vitamins are not taken. And how long do they have to take these vitamins? For life, because the changes that we've made in the digestive system are lifelong changes, obviously. So it is a new habit. It's a new way of looking at what their body needs. And taking vitamins has to be second nature for them going forward. It's not just enough to take vitamins, but it's also important to make sure that periodically blood tests are done to see that this vitamin intake is adequate, right? For a number of reasons, even taking certain vitamins, some patients could still be deficient, and they may require even higher levels. And unless we do blood tests to check on that, there is no way for us to know. And that's why, as you said at the beginning, it's critically important for patients to follow up with us on a regular basis. In fact, we want patients to be lifelong patients of our practice, so that after the first 2 years, we want them to follow at least once a year with us. And during that encounter, one of the things we will be doing is to make sure that they are nutritionally in good shape, that their vitamin intake is appropriate. And one way for us to measure that is to do blood tests.
Now, so when this question came about, let me say, why do they have to take long-term, lifelong? So as far as you know, I did not have a bariatric surgery, right? I didn't need bariatric surgery, but one thing that I'm doing is taking vitamins every day, and I don't have any known disease. So these are supplements. So I want to kind of define the issue so that patients who are going through the surgery, they don't feel like they're a victim of this, and it's just because they have the surgery, they have to do it. So after a certain age, based on their life style and eating habits, we all need supplements because we don't get what we need from the food. So this is pretty clear. So, and therefore we are going to need, like my dad didn't have a surgery and he has his vitamins based on his age. You are taking vitamins this morning. This afternoon, I got my B12 shots in my office. So, this is already part of everyone's life.
It is. It
So,
is.
Those patients who are watching, I want to make sure that they understand that this is not because they're going through the bariatric surgery. It's just like that. It's more important for them to do this. I may skip 1 week and I may still be okay, but for them, it's going to be more challenging. That's why we want to make sure that they have a good understanding of this, so then the potential issues would be eliminated. Now, speaking of potential issues, dumping syndrome is one of the issues that patients may have, and this is usually due to the sugar and or high-fat meals. So weight regain happens when old habits resurface, and we want to make sure that patients are well educated with what they went through and what they need to go through. How can patients avoid common complications like dumping syndrome or weight regain after the surgery?
So dumping syndrome is something that happens much more commonly after gastric bypass. And that is something that happens if the patient were to take refined sugars, right? So it could be a piece of chocolate, it could be ice cream, it could be a piece of cake. And what happens is when we introduce that highly refined sugar into the intestine directly, because that's what happens after gastric bypass, the body doesn't like it. The body doesn't like it, and it goes through a series of reactions that result in some very, very unpleasant symptoms. And it could be belly pain, it could be nausea, it could be sweating, it could be even fainting. So any patient who's had gastric bypass and who's had dumping syndrome once, they will tell you they will never touch a piece of chocolate or ice cream again. So that's essentially what dumping syndrome is. But to a much less drastic level can happen with some other heavy foods as well, particularly if the patients eat them after they've been, without food for a very long period of time. These are the basic things they need to understand, but there is a lot of trial and error as well that patients will go through. There are certain foods that don't bother some patients, and other foods may not be tolerable for other patients. And this may not be something permanent. It may be something that occurs perhaps in the first 2 years after surgery, but then it becomes much less of a problem later on. In terms of weight regain, obviously this is a concern, right? And it's a concern for patients from the get-go, because every diet that they've done in the past, every attempt that they've done has resulted in weight regain, and that's why they end up in our office essentially for bariatric surgery. So the main question is, can weight regain occur even after bariatric surgery? And the answer to that is yes. Now, is this very common? And the answer to that is no, at least not to the extent of regaining all the weight, because bariatric surgery is still very powerful. But what is important for patients to understand is that even bariatric surgery can be overcome if a patient is not careful, if they are not really attentive. In fact, there used to be a bariatric surgeon, one of the ones that taught us, over 25 years ago, who used to say, you can out-eat any bariatric procedure, if you even the duodenal switch, if you really try very hard. Which means that at the end of the day, even bariatric surgery is a tool. It's not a magic cure. So patients have to accompany bariatric surgery with a fairly healthy lifestyle that is focused on healthy eating, where eating is not mindless, eating has to be scheduled, where eating is not taking anything that's on the table, but it has to be selective. Patients have to eat healthy foods, foods rich in protein, foods that don't have too much refined carbohydrates, foods that are rich in fresh food. Those habits are critically important for bariatric surgery to be successful. So bariatric surgery is very effective, but it does require a partner in the patient as well, a partner that is focused on making it a success. And one thing that is clear in all these years in which I've been doing bariatric surgery, Kemal, I see patients who come struggling even 10, 15 years after bariatric surgery. And very often that struggle with weight regain will happen if a crisis has occurred in their life. Either they got divorced, or they've lost a loved one, or they've lost a job. Emotional stressors, right? And then they gravitate towards those old habits, which meant eating junk, not being careful about eating, not exercising anymore. Those are the times in which they have to reach out to us, because we're there not to judge them, we're there to support them. And we can provide support for them so that they can go back to eating healthy, and they can go back to exercising, and then start losing the weight again.
So I say this time to time in our sessions. So the issue is we need to, our patients, they need to come out of this victim mentality. So last Friday after our session, you made a statement. Well, it was a compliment. So then you said that I looked like if I lost weight.
Yeah.
And well, because we try. So, and I'm not trying to lose weight, I'm trying to maintain. So what everyone needs to understand that this is, the surgery is going to take you back to where we are. Everyone who don't have morbid obesity. But at that point, that comes with the responsibility of doing certain things altogether.
Sure.
So this is kind of like very simple. So like, last night, was storm and raining, and if you I don't know if you were out, sometime you watch your stars, and the thunder was so crazy last night. It's and I have I have Joshua's, and Joshua he's a puppy, well, not puppy anymore, but he's a dog, so like he would be scared of these things. And we are outside, and I needed to complete my steps. So I checked it, weather channel, and it stops at 10:15, and I still have to be careful with the loose branches and stuff.
True.
But we walk another 4,000 steps to complete the day, and that took me to like 9,000 total steps.
Great.
Now, unless we keep track of what we do, and we force it, and trust me, I didn't want to walk. And the night before, I didn't want to walk again, and I did the same thing. There was reasons to find ways to kind of go out of your comfort zone and then push yourself, and that's what we have to do every day.
Absolutely.
So, my older sister is going to be upset with me now, but I'm going to go ahead with it anyway. So she has cholesterol problem, right? And I'm on a FaceTime with her 2 or 3 days ago, and someone brought baklava to her office. Now, every time I call, although like this is going to be the second time I'm saying this today, that I'm not a clinician, my family and my friends, they think that I'm a doctor. Every time I call someone, they complain about some pain that they have. But this time it's the cholesterol. And I've been listening to this, and she's taking medications, but she is not watching it so closely. Now I said, what are you doing? She was about to eat the baklava. She's like, oh, should I not eat? I'm like, we just went through your cholesterol results, and we are trying to figure out how can we actually reduce this. And now, randomly, you are eating something. This is just nonsense. So this, this requires responsibility from our side. So It's been almost 6 weeks. I came back from Turkey, and I did not, with exception of one time, I didn't have any ice cream. Like you mentioned ice cream earlier. Well, I love ice cream. I want to have ice cream every day, breakfast, lunch, and dinner, late dinner, whatever. But I don't.
Right.
And
right.
that's kind of like the time that I'm not following it, I'm actually gaining weight. So that's simple. So
Yeah.
like I think setting up the expectation and understanding that this is not a punishment. Now you have to do X, Y, Z. No, it's not. Like we all do it. I mean, Ethan, he's running 5Ks in 23 minutes.
Great.
He used to be faster, but now he's slowed down. But with age and everything else, he needs to make his own adjustments. I have to make my own adjustments.
Absolutely.
Right? So you are making your own. So, but it requires constant effort
And focus, yes.
and focus. So, and you know, you have to be able to say no to that baklava when it's in front of you. And people shouldn't really bring them either. But it's kind of custom, and we know we cannot change certain things. But say no. I mean, that's that simple.
Absolutely. Absolutely.
Now, many patients they think that surgery replaces the need for exercise, but we know that long term relies on heavily on incorporating movements into the daily life. And what's the role of physical activity after bariatric surgery, and when should patients start exercising after surgery?
So physical activity is critical after bariatric surgery for a number of reasons. Now, when should they start? My answer to that is immediately, right? Because when we talk about physical activity, we're really talking about movement. The old idea of, you know, staying in bed because you have surgery is absolutely a no-no, right? In fact, you should be out of bed because you had surgery, and that's very important. So patients are encouraged to be up and about and walking as early as 2 hours after surgery. And then when we send them home, that's another thing we tell them, is that they have to walk frequently. So that walking is actually physical activity, right? So they start immediately. Now, there are certain activities that they cannot do until they are about a month out from surgery. And that really includes exercises that engage the core abdominal muscles, whether it's sit-ups, crunches, you know, like the ab muscles, or weightlifting. You know, weight anything heavier than 20 pounds, we tell them you cannot do that for about a month. But other activity, particularly in terms of walking, even walking briskly, even going on a stationary bike, or even going on an elliptical or a treadmill, they can start it within the second day, the third day after surgery. Now, their energy level and their comfort level will require them to start at a slow level of intensity and build gradually, right? But that's what we want them to do. So exercise does not necessarily have to wait until a month after surgery. It starts immediately, but it has to be gradual in terms of its intensity. And as I said, there are some exercises that should not be done until they're about a month out from the surgery. In terms of long-term engagement with exercise, this is critical, Kemal. As you said, first of all, one of the best ways to maintain your weight loss is to exercise frequently. Exercise by itself doesn't get you to lose weight, but it's wonderful in terms of maintaining your weight. We advocate a combination of exercises, aerobic exercise as well as resistance training, particularly because we want muscle mass to be preserved as well. Now, one of the advices I give to patients is to really go to the gym about 2 to 3 times a week and try to do that. And if they've never done that, perhaps engage with a trainer, at least at the beginning, for them to really learn about it. So this is important in terms of maintaining weight loss in the long term. But also it's important for them to stay in shape in the long term. We don't want to be extending life and then for patients to become frail at the end of their life. We don't want that, right? We want them to stay healthy. We want them to have good balance. We want them to have good bones. We want them to have strong muscles, even later in life. That's the best way to really live, you know, even later in old age. And to do that, exercise is very important. But as I said, and it's critical for people to understand, is the foundation of exercise is movement. The foundation of movement is walking for us humans, right? So what you were showing earlier on about tracking your steps every day is actually something so fundamental that everybody living in a industrialized country like the United States should be doing, because everything is so automated that if we didn't really have any conscious effort to walk, we would be sitting down all day long, because we get up from our chair, we go to our car, from our car we go to an elevator or to an escalator, from there we go to another chair, and then so forth, right? So we have to make an effort
Trying
to
to
walk.
find the closest parking lot to the entrance.
Absolutely, absolutely. Everybody fights for that closest spot, right? That's our mindset. That's the way we live. We have to overcome that by proactively walking. And technology is providing us wonderful ways for us to track this, whether it's a smartwatch or the smartphone. If we have them on ourselves, they can show us, right? And I tell our patients that the goal should be to try to walk 7,000 steps a day, right? Now, that could sound too much and daunting for many patients, and I understand that. But we don't expect them to get there overnight, right? But we want them to aim for that. And you cannot really get there unless you are tracking it on a daily basis. If you're tracking it and you see where you are today, then you can tweak your day next door, as you said, for instance, parking your car further away, or taking the stairs instead of the elevator, or taking the longest route when you are in a store or in the mall as opposed to the shortcut, so that you will have more steps. So when you're adding more steps to your day, you're not just adding more movement, but you're subtracting some of the sedentary part of your day as well, because you cannot be sedentary and moving at the same time. You're either moving or you're sedentary, right? So the more you move, the less sedentary you are. So to summarize, physical activity is critically important. It's important from the get-go. It has to be built gradually, and it has to become a part of lifestyle for our patients in the long term.
No, I personally believe that small challenges, obstacles, and how we approach them day to day, and some of them are very simple, but people don't realize how much energy they waste for these simple things. So I'll tell you what I mean. You know, we are saying from the physical activity standpoint, people should be, parking their cars a little bit farther away. But how much effort and energy they have to put in psychologically to get that closest parking lot, and if they don't get it, how much disappointments they go through, they underestimate that.
Absolutely.
And there are certain things when you remove those obstacles, you don't have this build-up stress, which those little things do add up, and that becomes heavier later on. So just make these things simple. So I park as much as far away as possible where I park.
Absolutely.
Even in the office.
Absolutely.
I mean, where I don't park in the.
I know.
And with the time that I come in, I can park closer. But I don't, because I know that walk is going to help me. But also, I don't have to worry about, well, this was my spot and someone took it. So I went to the least expected spot. So then no one takes it. Least desirable. No one takes it.
Yeah.
So, when you split an apple, like if I'm going to share this with you, like this thing, maybe we can elaborate this at some point later in the episodes. The energy that I put into this to make sure that I get the bigger piece is not worth it.
Absolutely not.
So if I know that one of them is bigger, usually what I do is I just give it to the other person, so I don't have to deal with the guilt and the wrongdoing. So then my mind is clear and do other things.
Sure.
So then I can make 5 apples instead of wasting my time. Like I'm going to get this bigger piece. So this is a parking lot, same logic.
Smart thinking.
Don't try to go to the closest one. It's not helping you physically and mentally.
Absolutely.
So this is kind of what we have for today. And I know starting with the new session, new cycle, we are trying to bring a new approach and try to actually present this in different ways for our patients and people who are benefiting from watching our shows. And again, we want to thank Dr. Irgau for joining us.
Of course, thank you.
And knowing that everything comes from our board-certified physicians, surgeons, it's important. And also for us to be here every Friday. I know this is a great resource for our patients. This week, actually, I talked to a couple of the patients, and they already knew who I was. I'm the other guy on the video. So, and that's kind of, it's a way of connecting with our patients. And that was also really nice so that they know who they are talking to. So,
Of course.
And we'll be back with another episode. Next week is 4th of July, so we won't be here, although like I try to have my 4th of July preparation in my pocket. So we'll be back in 2 weeks, but next week there will be a premiere event for at the same time. And until we are back, please stay safe and stay united. Bye-bye.
Absolutely. Bye-bye.